at during our committee of the whole, just acknowledge that we're on Treaty 6 territory. We're going to go through reports from administration, and we're going to add a report here for the airport, which is for chip seal, surfacing of the private hangar lots, taxi lane, and the mid-sized hangar lots and taxi lane. We're going to do a bit of a shuffle here on the agenda. We're actually going to start with 2.2.
Just with that addition, can I get a motion to approve the agenda, please?
I will move to approve the agenda as presented.
All in favor say aye.
Aye.
All opposed say nay. Okay, motion's carried. We're going to start with 2.2, then go to 2.1, and then go with the addition that's come to the agenda tonight. We'll start with Dr. Kaketla, are you there?
You might still be on mute there, Dr. Kaketla. If you're using Zoom on the phone, it's *6.
Is it actually?
I think so. Try it.
And we'll get there too. Yeah, for sure. While we're doing that, let's just talk about the mask mandate that is on here and the letter of support from the community. So as you can see, there are various letters that have been sent into the town regarding mask mandates, and also potentially I want to put it on the table here too about what is being, in my opinion, sensationalized vaccine passports, but I'd like to just call it proof of vaccination. And so yeah, I just want to open up the table first and foremost for if anybody has any things that they want to talk about, feelings about it, and then we'll bring a resolution to the table.
Well, I read pretty much every letter that's in the package, and obviously there's, people on both sides of the issue, and I can understand. I'm fully vaccinated, and I encourage people to be there, but at the same time you got to respect the privacy of people, and that seems to be more so. It seems to be more of an issue about not having the right to their own privacy as it is that there's so much against the vaccine. And so, when we look at this type of a policy, my concern is, first of all, the province hasn't mandated a system in place to do the passports. And unless we have that in place, it's going to be hard to administer something like that. The other thing is, when we're looking at our facility, our children under 12 years old cannot get vaccinated. They're not going to have a passport anyway. So we're going to say kids under 12, you're not allowed to drink. So,
Right, so, yeah, no, for sure. So I think we're going to go to Dr. Kaketla just because she is a very busy person. And then we'll continue our conversations and any questions she has. That way we can let her have her evening. Dr. Kaketla, can you hear us? You're just on mute there again.
Yeah, I tried calling, I couldn't reach her.
No, she was off mute there for a second.
By the looks of it, she's on the phone. It shows that the phone mute rather than a regular mic mute.
Oh,
So
I see.
I'm guessing she's on her phone calling.
Oh, there we go.
You can hear us.
Did you text her?
I am. We're ready to go. She's very eager to have a chat, so.
I'm just going to text her. Text her? Send her a text.
Could we potentially just call Econ if she's just calling in?
Yeah, that's true too.
I tried calling her, couldn't reach her.
Okay. So I think what we need to do first, because I think that there's sort of two issues here that we need to tackle. Oh, Dr. Kettler, are you there?
Oh, hi there, Mayor. I apologize. I'm on call, so I had to take a different call.
No, no worries. We appreciate that you're busy. We appreciate that you're a busy person, especially now. Thank you so much for being here to give us a bit of an update on our current situation, just so that it'll help us make our decision based on a mask mandate and as we talk about our vaccinations and vaccine passports as they're dubbing it. I'll give you the floor.
Absolutely. Thank you so much, Mayor and Council. I really appreciate the opportunity to join you this evening. Steve, I'm wondering if I'm able to share my screen.
Can you have host abilities?
Oh, there we go.
Perfect.
Yeah. Okay. Are you able to see it?
Yes.
Okay, perfect. Thank you so much. So I'm going to be brief because I think I think it's most important for me to be able to hear from you than it is for me to kind of tell you stuff that you already know. But I think I wanted to emphasize some key things, and I brought some Orange and area specific data. I think that would be helpful in terms of informing your approach. So I haven't had the privilege, I think, of meeting all of you who don't know me. My name is Dr. Kettler, and I'm a medical health officer who is based here in Orange at the Population Health Unit. Although in terms of our coverage area within population public health, we do cover all of the far north within the Northern Administrative District, including the Athabasca, the Ox-Reserve part of it. What I'm going to share in the first few slides is nothing new. We know by now that Saskatchewan has the highest new case rates amongst all the provinces and territories in Canada, which is quite a challenging situation to be in. And this is the data as of today. You can see our case rate is quite high. The only one that is close enough to us is Alberta, and the rest pretty actually recognized is the others are pretty, with all of activity, I think, mostly concentrated within the western provinces. In terms of the actual, if you look at the northern areas as well, we're pretty high in terms of the case rates if you compare it to other northern areas, and so that's quite a challenging situation that we find ourselves in. I think this is also a milestone that we've reached as of today, with the highest new case counts that have been reported today than we've ever seen in the pandemic. We've gone over 506 new active cases as of today, and I think I'll point to that first row that you see with about almost 20% of all the new cases being in the younger age group, age between 0 and 11 cases. And I think this is additional evidence of what a difference the Delta variant has made in terms of our cases as well as the transmission. Initially, we thought we knew the highest rates of new cases to be amongst the elderly and those with underlying conditions, but now we're seeing more and more children affected. And as a result, we're seeing quite a bit of school-related exposures as well as daycare-related exposures requiring a bit of follow-up. And I think that's quite reflective of the activity that's in the community. This slide just shows it's an assessment that we do on a weekly basis as a group of medical health officers across Saskatchewan. And it essentially just gives an assessment of what we see the risk of transmission by zone, both on and off. And this one is as of last week, Wednesday, but I suspect it has not changed much. There might be a little bit more of it, I think, in the south. But you can see that our assessment of the far north areas, and that includes the Orange and the Tri-Community areas, was that there's a high likelihood that COVID-19 transmission is not controlled. In terms of transmission, what we're seeing is that the majority of cases are in the unimmunized and partially immunized, and that's really what's driving the transmission and activity that we see now. And if that's left unchecked, it will certainly spill over into the unimmunized. We're still seeing a small proportion of unimmunized people affected, including amongst those who are hospitalized, but it's a very, very small minority. And our health system has really felt the pressure over the past few weeks, especially the past couple of weeks. And as I mentioned before, even within the realm of public health, with the school reopening, even in the far north here, we've been following up quite a number of school-related exposures. We haven't really seen transmission spreading within the school setting or outbreaks, but certainly we've seen people who have been exposed outside and then attending school while infectious, and so we're monitoring quite a number of cohorts, hoping that there won't be additional cases resulting from those types of exposures. And I think looking at over, we can see that because our province continues to have the lowest immunization rates in the country, and when we look at a younger age group, including those ones who most recently become eligible for vaccination, those have the lowest uptake. And really, if we ramped up vaccine uptake in this age group, it could make a significant impact. And we'll see when we look at the latest data for immunization coverage rates for the Orange area, that this correlates quite nicely with that. And so you can see that our highest burden of disease in the country is directly linked to our immunization coverage rate. And I think we can also agree that it relates in terms of the with the lack of public health measures that are evident in place in other jurisdictions. So we certainly need to do more, and there are things that we can do, which is, I think, a good part of today's discussion. Vaccine passports, which have been shown to really make a huge difference, mandatory employer immunization policies, particularly for those who are working with the most vulnerable children and other vulnerable populations. Incentives, there is a role for them, but we know they don't seem to work as well as mandated requirements for vaccinations for entry, particularly in specific places, and other innovative distribution strategies, and what we also know to work in terms of effective measures, because we have gotten through phases where we've come down because we had specific measures in place through public health order restrictions. I just want to talk a little bit about our health system capacity, because it is something that has started to make people very nervous, and rightly so. From a public health perspective, our contact tracing system is overwhelmed. We're not reaching all of the contacts that we should be, and so obviously there are cases that are being missed. We're seeing transmission, including in the north, mainly between households, which is nothing that's new, but the other concerning phenomenon that I've seen over the past few weeks as well is outbreaks that are resulting from large gatherings, weddings, other types of gatherings where people have gotten together, and then within that week or second week, we see quite a large number of people, and those are the ones who come forth for testing. So you can imagine in terms of close contacts and those who are not diagnosed, there's still some level of undiagnosed transmission occurring. And we know that the north is different, as are other jurisdictions in the south. There are some people who are anti-maskers. We've seen the protests that are going on down south, including those outside hospitals. There are anti-vaccination people, but there are also elements of hesitancy that are not necessarily anti-vaccine sentiments. People are just hesitant. They're misinformed by myths that are taking place through social media, which is very unfortunate. And then, some of this approaches are, hesitancy is influenced by, historical trauma and past history with the medical system, which is, understandable. There's issues of access as well, which the health authority has been working very diligently to try and increase, including allowing mobile testing as well as more flexible hours. And then the other, I think, challenging issue that has come up more recently, now that we're reaching this threshold in terms of health system capacity is where tough decisions have to be made by physicians and others within healthcare in terms of prioritizing who gets the urgent care and who doesn't. And obviously that's not very fair to those who have received the immunizations and who have adhered by all the recommendations. The next slide just is more specific to Laurent. I wanted to just make this a little bit more close to the home. Sorry, I have to move this. And this shows the daily case rate, and you see the threshold, which is the lower.
Sorry, we're just minimizing a window so we can see the full screen. Thank you.
Oh, I'm not sure what happened to my screen. Can you let me know what you're seeing?
We can see half of your screen of your first slide.
It was on our end. If you hit maximize on the screen there again, we'll be just fine.
Just pop up your screen at
Okay.
the top. The big square by the X.
Yeah, I'm not sure what happened. Oh my God.
No, it was, I think it was our fault because we were just moving one of the windows on our side so we could see the full graph.
Can you see your full screen?
Uh,
Or is it just us? Okay, there we go, got it.
Okay, we'll go with this version then, sorry. Yeah, and so, I'm gonna go back.
There, yeah.
Maybe we'll walk it over and want this version.
If you go back to full screen, it'll be fine as well.
Like view from current
Okay.
slide, slideshow.
Not sure why it's not, I can't even make it, oh, here we go.
There.
Thank you.
Awesome.
Okay, thank you, I apologize for that. And so, in terms of our case rate, you can see, without getting into too much detail, you can see that we've steadily increased from August until now, where our threshold, so the red line, which is the threshold of 10%, of 10 per 100,000 is way above that, and way above what we see as the 7-day rolling average for the province of Saskatchewan. So, you know, it's beyond comparison. And then I also wanted to talk a little bit about the test positivity rate as well, which you can see is quite high when you compare it to the provincial test positivity. I know for the province, I believe it was about 13% or so. And essentially what that tells us is of all the testing that we're doing, that's about the proportion of cases that are coming back positive. And that's quite high because, and it tells us that we need to do more testing because we are missing cases out there. And so even for the orange area, you can see that this is concerning, so we do need to ramp up our testing. What we're seeing as well in practice, and I'm not sure what the hesitancy is for people getting tested, we're seeing people either not get tested or coming in quite late after symptoms have started, and so by then they've already exposed others and potentially exposed, you know, schools, etc. So that's quite a challenge as well. So part of the messaging that we're trying to emphasize is to still get tested as early as possible at the onset of your symptoms. This slide is the analysis that we did today, and that will be shared with the community tomorrow as part of the weekly report, where we can see that in terms of fully immunized people, we are increasing the proportion in each age group, but we're still not quite where we need to be yet. For Laurent area, the proportion of fully immunized people only increased by 1% from last week's analysis, whereas about 57.7% as of today's analysis, and the people who have received first doses about 70%. So that's still, like, I think we need a lot of work to do there. Initially, when we were talking about where we need to get to ensure that we get a population level protection, we were kind of thinking, 80%, 85%. But I think in the context of the Delta variant, we really need to be aiming higher than that, especially knowing that our little guys who are less than, born after 2009 will not be eligible for immunization, at least over the next several months. And so in wrapping up, I think I have a couple more slides. We're definitely in the fourth wave. All our modeling predicts that we're going to be, if nothing changes, in a very terrible situation. And the ICU capacity, et cetera, which is a very late indicator, really just shows, how challenging our current situation is. And I've already talked about this, and some of the measures that we know already work, including indoor masking policies, trying to keep distance, working from home as much as possible, and limiting large gatherings. On Friday, the province announced the public health order for the province, which came into effect yesterday, but it will have very limited impact. And for the mental health officer group, including myself, we were quite disappointed that it didn't go as far as incorporating the recommendations that we had put forth as a group. And we know that we need a lot more than just vaccines. We need masks. We need to reduce our contact. We need to buy time while we ramp up our immunization. And I think leading to your discussion, which is very important this evening, some municipalities and also some school districts, including the ones that we've been working very closely with across the north, and we've had excellent collaboration with them and cooperation in terms of putting in measures to protect kids within schools. Some municipalities have gone and enacted some measures which are within their capacity. And from a medical health officer perspective, I strongly encourage Laurent to move forth with implementing what is within your jurisdiction. I want to highlight, because sometimes we get this question in terms of what's within the authority of medical health officers. While we have, I think, a lot of authority in terms of control of communicable diseases and other health hazards within the population under the Public Health Act, we do have some limitations. One of those being the process for being able to issue local orders. Right now, we would require a ministerial sign-off if we wanted to issue specific orders, such as mask mandates for the north, or any other additional measures like restricting movement, those types of things. And that's something that we've been navigating carefully throughout the pandemic. We're right now in the process of consulting our health authority legal counsel to see what else can we do that's within our authority while we still hopefully wait for the province to move a step further in terms of enlisting additional measures. But I think you have a lot of flexibility and authority within your capacity as mayor and council. And so I urge you to move forward with, for example, what the band has done in terms of vaccine mandates, proof of immunization. That is things that we know work. We see places like Quebec and British Columbia where they have seen the immunization coverage rates just shoot up as a result of those things being put in place. Indoor masking policies make a huge difference, even from the modeling that we see. They can really work in tangent with all the other measures, including vaccinations, to reduce and mitigate the spread that we're seeing and the threat from the Delta variant. So any other options that are within your capacity, I would strongly encourage that this is the time to do so. In fact, I think we're a little bit behind already. These things perhaps should have been put in place a while ago. I think we were hopeful that the province would, it's always easier when things are done at a province-wide level. But until that's done, I encourage you to just do what it is that's within your authority, Mayor and Council. I think this is my last slide, and I would like to thank you for this opportunity. I'm happy to take any questions. Obviously, there's a lot more that we could have put in terms of details, but I know your time is limited, so I will pause there. Thank you.
Dr. Coquella, really quickly, I just want to confirm some details. Just from the work that I do, is it true now that the ICUs down in Saskatoon and Regina are now full and they're now rerouting people to L'Orange? Is that correct?
I'm not familiar with that specific piece, Mayor. I know that as of a few days ago, we were evacuating people from the north down to Regina, but I'm not aware of that reversal. If it's as of today, I don't have that information. Thank you.
Okay. Just for council's point of interest, I do know that because we are rerouting our flights that we can't even take patients. And they're now sending them to L'Orange. So just a point of interest with that. Anybody else have any questions for Dr. Coquella?
I do. Dr. Kettler, it's Viviana here. Are you aware of any jurisdictions in this province or within the western provinces with high incidences of COVID-19 transmission and positive test results that have implemented vaccine passports?
Yeah, I can give a, I'm more familiar with British Columbia because that's where I trained and I have some connections there. So my colleagues there, the Interior Health Authority, Kamloops, et cetera, that area, that they were able to enlist a regionalized order before the province moved to a province-wide mandate for, first of all, the masking, but also the proof of immunization for entry in specific areas. The northern region there as well went the same approach. In Saskatchewan, I can tell you that there are specific jurisdictions that are moving that route. Saskatoon is in, I think, final phases of their discussions with their medical health officers. The Lloydminster, kind of that area as well, we're in engagement with their NHOs, including today. But I think the approach that we have decided to take is a north-wide one. If we were going to put forth a submission to the minister to say, we need these things, if you're not going to put them in all, across all the province, we would like something specific for the north that is time limited. And I think there's some, we are very sensitive to the fact that, based on our previous experience, last year when the north was treated a little differently because of the situation there, that resulted in some, stigmatization and some unintended consequences for some populations. So we want to avoid that, but at the same time, not doing anything is pretty risky as well. So that's as far as I know in terms of specific jurisdictions in BC and then here. Also out of Ontario as well, some of my colleagues in certain parts of that province a few months ago actually went the route of sort of deviating from the province and instituting local orders, but their legislation is a little different that allows them to be able to do that, as is the BC legislation in terms of what their public health legislation allows them to do. So we're a little bit limited in Saskatchewan because we don't have the same avenues.
Thank you.
Again.
That's for sure.
Yes, I have a question just about number one. I guess it's a two-part question. Number one, if you were to provide advice to L'Orange on exactly what the best and most ideal step to take right now would be, what is that? And two, within some of the feelings for or against implementing a proof of vaccination or proof of immunization kind of program, how far can we go to be as open to alternatives as possible? So i.e., if we had a proof of vaccine mandate, can we exempt children under 12 and also accept a proof of negative test within 48 hours? Can we go farther than that?
Right, no, thank you for that. I think it's an important question because I think you're trying to balance some of the backlash that may be coming from some members of the community who may not be as receptive, but also trying to balance, what you have within your capacity to protect the broader population, the majority of which have accepted immunizations and are willing to sort of ride it out and sacrifice wear masks. So I'll target the first part of your question in terms of what specific things can we do, and I think these are, one would be the mandatory masking for all indoor public places, particularly those ones that the town has the authority to, I guess, exert influence, and the Uniplex is a good one, as a great example. And I think the fact that precedent has been set with the band, with J.R. Hall, I think hopefully that would be easy enough for people to understand that you're not necessarily doing something that's very unusual. The second one would be mandatory immunization policies for, and I don't like to use mandatory immunization as a condition of employment, particularly for example, for town employees. Obviously that sets the tone, I think, for the rest of the community. It won't necessarily target as many people or capture as many people, but I think it also provides a good example for other types of workplaces to do so. I have communicated directly with daycares all across the north, for example, recommending that they really look at this because they have a vulnerable population. The third thing would be proof of immunization or COVID-19 passport for entry to specific non-essential services. So, gatherings, social recreational events, if there are specific businesses that can be influenced as well to do the same within the community, I would greatly recommend that as well. And the others would be, you talked about the testing. I think that can still be provided as an option, but it's not a substitute, I think, for any of those. Obviously, proof of a negative test within a specific time frame would be sort of an additional layer of reassurance, but it doesn't necessarily guarantee that somebody could not be infectious, even if they had a negative test yesterday. So as long as people understand that there are limitations there, I think, at least it's sort of, you're giving some people who may not necessarily have the ability to receive the immunization, which I would be very surprised because it's a very, very small proportion of people who would actually have an absolute contraindication to the vaccine. And then I think anything related to gatherings that you can restrict as well would be advisable while we get to a position where the community has sufficient coverage. The challenge here too as well is that the north is not isolated, right? People are traveling back and forth for many different reasons, and some of that travel being essential. We can't be isolated, and so sort of emphasizing the message that the more that we can limit our gatherings, our contacts, as well as travel that is non-essential to areas in the south that are seeing quite a bit of transmission. I mean, at this point, transmission is everywhere, so the more that we can limit travel to the extent that is possible, the better. So I think those are kind of the key things that can be for your consideration. Thanks.
Just a follow-up from that, what is the capacity of testing here in La Ronge? I saw on your slides that it was very overwhelmed. So in La Ronge, with a referral, I understand you can get a COVID-19 test, but it can take up to 6 days to get a result.
And hours of wait on 811 sometimes too.
Yeah, and rapid testing is now available for businesses?
Mm-hmm.
So what is the benefit to the town having available rapid testing for reasons?
Right, that's an excellent question, and maybe one other thing that I didn't mention that could be part of the workplace policies, and that's something that I've been recommending as well. The health authority has implemented the rapid antigen testing kits as an option for healthcare workers. I had it myself and been testing myself and my family. But also there's the Test to Protect program that I think you'll probably be familiar with if you just Google Test to Protect Saskatchewan. Organizations and workplaces are encouraged to sign up. I've been sharing that link with different organizations in the north to sign up. It's an easy sign up process and I think it's a 2-page PDF with a bunch of tick boxes that can be submitted. Then the application is reviewed usually within a business day and approved, and then kits are shipped, and then there's a bunch of reporting requirements. But it's really easy. It does not require any healthcare professionals to be able to administer the test. You get the results in 15 minutes, and it's a good surveillance tool. It's not a substitute for testing people who are symptomatic. For that, we still recommend the PCR test. And so I can understand it can be a little bit inconvenient. One thing that's, and again, the health system obviously has capacities and limitations. Our testing is available during weekdays, and during weekends, I believe we're still kind of on standby. So if there was to be something that required quite a large number of tests, the test site would be open. But in terms of the officer test site here is really Monday to Friday during those hours. But it doesn't mean that testing can't be done outside of those hours. If there's a contact trace investigation that requires a lot of testing, testing can be available through the emergency room as well. But obviously, the emergency room is not just other things. Elective testing cannot take priority, which is really unfortunate. So in terms of rapid testing, sorry, I wanted to mention too, in terms of how long it takes them to get the results. The GeneXpert test that we have within the hospital of Orange gives a result within an hour. So that, for those high priority cases, those that run on GeneXpert, it's not an issue at all. What takes time is the non-urgent testing that's done and then routinely shipped down south, depending on the reason for testing, or if somebody's symptomatic or asymptomatic, they'll get prioritized, and then that may impact the turnaround time. And usually it's impacted by the time it takes to travel down to Regina. Because once it gets there, usually the turnaround time is about 24 hours. And then if somebody has the MySask Health record, which we've been encouraging, and I know there's some glitches there in terms of people gaining access, but that's the quickest way, because sometimes people are waiting for that phone call telling them that they're negative, even though their result was reported, 2 or 3 days before, depending on what the capacity is for the healthcare system to be able to spit out those results. So if people have access to that electronic account, they can access their results as soon as they're reported, so that makes things easier. But obviously that's for people who have the ability to do so, and I think we acknowledge that not everybody is able to navigate that system. And so unfortunately, because of the challenges of the health system capacity, we're not able to accommodate everybody, which is quite a challenge and can be a barrier to people accessing testing.
What's the cost of rapid testing compared to conventional testing they're doing right now per case? Have you done a comparison?
It's fairly inexpensive. Sorry, go ahead.
George, I'm not sure if you meant rapid in terms of the GeneXpert testing, which is the one that's in the hospital that gives us results within an hour, which is the PCR test, or the rapid antigen testing, which is a test kit that you can take home.
Because it seems like, we've been told that millions of rapid tests were bought by the federal government and they're supposed to be out there somewhere. And we're getting our system all bogged down and doing all this testing when could not rapid testing be done to free some of that time up?
It costs $10, and you get 25 rapid tests, and they can even be picked up from Giant Tiger today.
So you have to be a registered business.
Yeah, you have to be a registered business or a nonprofit. You can't just be an average person from the street to go and get it. Is that correct, Dr. Kakela?
Yeah, so the ones that you're describing there, I think, are through a different avenue or different pathway. So I don't have the specific dollar amount for those, but I'm pretty sure you're correct. In terms of the ones that I described that are through the health authority, those don't cost anything in terms of the people who actually sign up for the process. So that's a little different, and I think an incentive for people to really sign up for those. And I think the more that we can have that in the north, because I think other places are really taking it up, other types of places in other areas of the province. So the more that we can encourage people to do that, but it doesn't cost them anything really except for that sign-up process time.
So,
I think that it's worth the investment.
Can I just clarify something with that? So anyone do they just call 811 and then they can get they can have access to those rapid tests? Is that what you're saying?
No, there's a
No, so this is, oh, sorry, I think Jordan, you want to say?
No, go ahead.
Yeah, no, this one is specific for, it's called the Test to Protect program, which is a provincial approach essentially to promote rapid testing as a surveillance tool for businesses, workplaces, those types of places. So it's not necessarily like if you're just a person, an individual, you can't just sign up for that unless you're doing it for your workplace or something.
Okay.
So that's the limitation. What I would ideally like to see is, to get to your point, like what other places are doing overseas, the UK, for example, where you can just get these things and they're very cheap and you can just, buy it off of, Shoppers Drug Mart or something and test yourself and your family. That's what I'd like to see.
Yeah, I mean, those are expensive. Like those run in excess of $100 sometimes. But I guess it would depend where it is. Because I've seen those tests, and that's a deterrent when we're, I think, making our decision at this table. But,
Sorry, one more follow-up question, and I don't know if this should be directed at you or a lawyer, but do we have the right as a municipality with our public facilities to request the vaccinations or immunization status of a person that is about to enter?
Right, yeah, and I think this is where, because our province is lagging a little bit behind in terms of providing that proof of vaccination tool, such as what is being provided in BC, it presents a little bit of a challenge. I think that's a question that I would encourage you to direct to your legal counsel. I mean, there are other jurisdictions that have moved ahead in terms of requesting these things. So I think there are ways of doing it. But I think I would encourage you to ask for specific guidance about what you can ask and not ask.
because there hasn't been any precedence in the legal system yet, right? Which is why, what?
PC that has.
Okay. All right, we'll follow up on that. Okay, is there any further questions for Dr. Kakela specifically? Because then I think we're going to debate further.
Couple quick ones. Do you know what the age range is currently under Health Canada for what the youngest vaccination can be?
Sorry, can you repeat that now?
Like under Health Canada or Saskatchewan Health Authority's recommendation, what is the youngest that somebody can be vaccinated?
Okay, so anybody who was born since 2009 can go ahead and get their immunization. So initially it was the cutoff was, if you're 12 and over you can, but that was adjusted to just the year of birth in order to be able to capture those little guys. We're eagerly awaiting a time when we can, I think the next one is going to be anybody between the ages of 5 and 11, but we're not at that place yet within Canada.
Another question I have, thank you for that, is what, you said that any of these mandates that we have municipally might or will trigger a ministerial sign-off. Do you know what the turnaround time is on a ministerial sign-off?
I don't know, unfortunately, this is part of the discussion that we were having actually. I believe through yours, it would go through the Minister of Government Relations, I believe. The option that we have goes through the Minister of Health, so I don't know what their turnaround time is, but I think they would be able to recognize the urgency of the situation, and hopefully that can be prioritized, but I don't have an answer for that sort of thing.
The last question I have, I want to preface by saying I'm not upset with any of our local healthcare workers or professionals here. But a question that I have to ask is, in the first 3 waves, the provincial government wanted unity across the province. Is there a reason why they're not doing that with proof of vaccinations or public health orders like we've even seen in the first 3 waves? And I understand that you might not be able to answer that, but it baffles me after seeing the slides today that we don't have some sort of provincial level of mitigating COVID-19 province-wide.
I think that's a fair question, and I'm grateful that you raised it. I'm not sure that I'll be able to give an answer from a public health perspective. I try as a medical health officer because I've been part of the discussions and have been, we've provided advice to our chief medical health officer. I think there's some, there are things that we can implement as a healthcare system, so that's one level. But there are also things that are within the mandate of the provincial government that are beyond our capacity. There's the Saskatchewan Health Authority, there's the Ministry of Health, and there's the provincial government in the Office of the Premier. And I think that, there are different factors that go into decision-making, some of which I can't speak to, obviously, at a level that is beyond me. But I think the health system has tried in terms of surge capacity planning, in terms of redeployment of healthcare workers, in terms of encouraging and prioritizing healthcare worker vaccinations in order to protect that system. But I think a lot of what goes into containing and mitigating this type of epidemic spread requires a lot more than just a health system capacity for our portion.
Thank you.
Okay, Dr. Kettle, thank you so much for all the information. I think that leaves us with a little more information for us to debate further at the table. I don't want to take any more of your time because I know you're extremely busy and you deserve some time to rest and then get back to it. So thank you for everything you're doing, and we'll talk to you soon.
Thank you.
Thank you.
Thank you.
Mayor.
Good night.
Take care. Bye-bye.
Okay, so let's, I think there's 2 things here that we need to talk about. One thing, we need to talk about our mask mandate, and then we'll talk about the vaccine passport if we're doing that. But the first one is the mask mandate, because I think that one has a little less potential, even legal ramifications and everything else around that. So my take is that we're at a point where we're seeing numbers skyrocket in our communities, in our outlying communities. It's one of the best ways that we can do without asking about medical information. And for me personally, I'd like to see that mask mandate be instated in all of our facilities immediately. Anybody want to talk further about that?
Point of interest, are we not doing that right now?
This is just a form of resolution to define it. Yes, we are doing it.
Yeah,
So
so,
it's
But-
current practice.
These current practices stands right now.
However, it's not mandatory. It's encouraged, right?
We have no authority to enforce it, though. We are strongly encouraging people to do it, and most people are, but we have no authority because we have no resolution.
Okay.
so sorry, am I interrupting?
No.
So at the mill right now, there's signs saying
We are
masks are
strongly
required.
encouraging, but we are not going and asking to leave and enforcing it.
Did it not say on the notice that it was
No.
required?
No.
Okay.
No, it just says
So if it
encourage.
is required, if we pass a resolution,
The signs will get changed.
so the liability is on the town, and for our user groups, ice holes, for example, at their games, if it's required in there, are they enforcing it or are we enforcing it?
We'll be enforcing it.
So the town will take on the responsibility, the liability when it comes to enforcing masking.
Yeah, we're actually
Okay.
pressing the rules, so
Yeah.
we're enforcing it.
Yeah, okay, I just wanted to like be clear. on
So
how
does
that
our
is.
motion need to be that we request ministerial approval to have a mask mandate in all the garage?
I don't think we need ministerial approval because we
They've
can
already
create that.
delegated authority down to, because other municipalities already passed it without getting ministerial approval.
I'll make the motion that we require mandatory masking in all town operating facilities.
I'll second that.
All in favor, say aye.
Aye.
All opposed, say nay. Okay, so that's that. I don't know if we want
Should we do
to,
an effective date?
Effective immediately.
I'll put in the,
I think we do, if we're gonna be,
I'm just gonna word it as a recommendation effective September 6th. I know it's passed, but I mean,
Okay.
just reinforcing it, so.
okay.
Okay.
Do we want to tackle the vaccine passport, or do we want to table that and get more information, sit on it?
I have a list of questions that I would like a little more clarity on. Do you? Yes.
Yeah, and I think that I would like for administration to consult with our lawyer to see what implications there might be around privacy laws and what is reasonable, although I would like to see some sort of confirmation of immunization before people enter our facilities. I really would like to find out a little bit more about the legal implications around privacy and what that could open us up to legally. And what it would look like. Are we going to go with a printed sheet off eHealth? Are we going to wait for the province to have their passport app developed? And the third piece would be what are some options for enforcement?
So I think we just need to get a report. Do you want to add something?
Yeah, in terms of, if you don't have like a phone app or something like that, it's very simple. You're going into an event, you show it quickly, you're not going to consume a lot of time. But if you don't have a standard system in place, which should be provincial-wide, hopefully soon, if they do that, then we can drop it, obviously we can drop it forever.
Yeah, because I mean, we were all given
But
those.
until such time, I really,
Yeah.
it would take a lot of man hours to manage and
Right, because we were all given those little cards, but you lose them, people that, you know.
You can go on the SaskGov.
And get your paper,
I
yeah.
turned mine on.
If you're signed up, and if you're not signed up, you can wait hours and hours on the, like, there has to be, like, to me, I think it needs to be a little bit of a rollout, but I don't know.
So my list of questions while Steve's got his pen out. What's the risk of a lawsuit? What other municipalities are doing proof of immunization? There is an article about Regina's rollout on CBC. Regina pushes back vaccine passport system until November 15th. So they have a passport system that they're implementing themselves for civic facilities. It was proposed to start September 20th, but it's being rolled back a couple of months now. The plan is expected to cost $250,000 this year. So that's like operational needs, additional staffing, new technology, so on and so forth. So that's large scale. What's happening in other municipalities? What are other small municipalities doing? What's acceptable? How will we enforce it? So if somebody pushes past our staff and says, I'm not showing you anything, I'm going to the game, or I'm going skating, I'm going whatever, are our staff expected to go and remove that person? You know, and do we have that authority? Who's responsible for removing people, and is the RCMP going to provide support if we need it in
Follow the
enforcing
rules
this?
of the facility, so I mean, I can answer the question right now, is that at the end of the day, council passes a resolution of rules of facility.
Yeah.
They do not follow the rules, no different than drinking, we just
Yeah.
talked about it tonight. If you don't comply, our staff will not be removing them.
Mhm.
The RCMP will be called, they will be removed.
Okay.
Period.
Yeah, because I guess it's no different than if there's someone looking at the game, but.
Yeah, or somebody
it's-
walking
but
around without shoes. and
It's just
saying,
really
"Oh."
heightened, yeah.
Yeah, no, and that's the thing is, I just want to ask these questions because these are questions that have been opposed to me floating around.
No, they're great. They're great for the report, for sure.
So what's the biggest obstacle in northern Saskatchewan to get people vaccinated? Like, it's probably about 40%, or not much more than that.
They had it up on the screen there, all the different ages. It's the young population, 39 and under, that hasn't hit that first threshold yet.
Yeah.
Yeah.
50 to 59 was the best, but
What's the young?
Is there any other things that need to be added to this report, or questions?
Just a timeline roll up,
Yeah.
what's going to look like time-wise, like how fast can we do it at once, and if we decide to move forward?
Yeah.
Timeline.
Well, while you're thinking, I'll give a point of interest. So the JR is rolling out a proof of vaccination. It's not there yet. Chief and Council did pass it for all employees had to be vaccinated by, I believe it's the 20th or the so it's very soon. There's no rollout. It's just an immediate, and it can be up to termination. It also goes for all federal employees. So, for example, with me flying, we have to be done by certain dates, with the ability that people can still get the first and then the second, so that it's not just like an immediate and you can be terminated type of situation. I mean, the JR is being exempt from what Chief and Council has put out. So we are implementing our own policy that is being developed as we speak, but nothing's concrete. So we're still working on the details on that because, again, these are questions that we have to still figure out. It's like, what's the legal ramifications? What other options are we showing for or providing for rapid testing? Is it under 12 years of age? Because I think the biggest thing that we have to consider too now is that, and what I wanted Dr. Kettler also talk about is that vaccinated or unvaccinated, you can still carry it, you can still get it. So it's not 100% safe proof. So we don't want to give that false impression that vaccination means that you're safe and you don't have to wear your mask anymore. Like, we still have to have a level of safety and community safety within our community. And once we see numbers rise again, like, that's why it's important for us to wear masks again and limit our gatherings. But right now for me, the only thing is that our only way out of this right now is we have a vaccine, we have no other options, and I think it's understandable where I sit on the fence with that. Did you figure out what you wanted to add?
yeah. I want to begin by thanking the countless heroes in the front line of this pandemic. I know with both my mother and fiance being nurses and them sharing their experiences and living with my fiance, obviously. And hearing some of the stories of the women and men that have missed the meals, the family gatherings, they've postponed weddings and family vacations to be in the front line of this pandemic for the last 18 months. I know that even further to this, we have seen some healthcare staff that could potentially be called back from leaves in the coming weeks and months if deemed necessary by the minister with the recent emergency order, with my partner being on maternity leave, and I know the stresses of having a new child and the stresses that puts on our family individually. With all that in mind, I first want to condemn all the people in the protest that feel it necessary to protest hospitals, health centers, and workplaces where people are taking care of people. They're near their breaking point. These acts are idiotic and unequivocally selfish. Enough is enough. Go to your MLA offices, email me, call me, I don't care, message your MP. We are the ones that are making the decisions on these, not the people that are busting their asses to keep us healthy. The amount of learning I think all of us at this table have had to learn in a short order on how we can best defend our residents and regions against the spread of COVID-19 has been stressful, hard to process, and nearly a full-time commitment to ensure we are remaining up to date on the best measures to keep our communities as safe as they reasonably can be. I know that the people that have put an X beside my name, and I hope most of yours this election, would look to you and I and ask us to trust in the experts in the field to make the best decisions and not only trust our own intuitions. That we would do our own due diligence on any matter before we rise in our seats and speak, and certainly before we vote on any matter. We would discuss the issue of a proof of vaccination or the necessity of a negative COVID test before entering the Malahide Unitiplex. I feel like we do not have the expertise to speak on medical fronts. But just as we are not addiction specialists nor police officers, we make decisions that support the people in those roles and those who provide us with the sound advice. I believe in the science, in the medical and health professionals, and trust that we have been given sound advice from our local experts that have used their extensive education, experience, and network to give us the knowledge that we would not otherwise have the opportunity to have. On that note, I want to thank Dr. Kaketla for her time tonight, and thank her for her service to her community and leadership, and look forward to maintaining a good relationship with her as we navigate the challenges that COVID-19 presents. All this said, I know that we are not alone on this front. I know that many municipalities, businesses, residents, and venues are looking for leadership from those on the front line, and rather than deplete our local resources, which are already stretched to the near breaking point, I find it odd that at the beginning of the pandemic, we had a government and a premier that wanted us to follow the direction of the Chief Medical Health Officer of Saskatchewan and the leadership of Dr. Shahab was able to provide at the beginning of the pandemic. Now that we are through the summer and looking to a fourth wave, I find it odd that we're sitting here today and we have not heard from the provincial government on the necessary steps to battle COVID-19 across the province, including in our region. We have heard from many on the ways that we have gotten through the first through third waves of COVID-19 and need the same leadership to navigate a fourth wave. Tonight, we've taken the leadership already by putting mandatory masks into our facilities, and I applaud every person at this table for voting unanimously in favor of that. Regardless of the leadership of the province of Saskatchewan, it is within our jurisdiction of what we heard tonight upon ministerial approval, and then we have to do what municipalities can do, and this is within our jurisdiction. People have the right to not get vaccinated, but you do not have the right to choose your consequences of not getting vaccinated. We have a right to build our rink back up. Kids deserve to be skating again. Our local SJHL team deserves to have fans in the stands and build back the economy of our local area. And the only way that we're going to get through this is through vaccination. We've heard it time and time again. We need public health orders. We need leadership from our municipality. And I would put it forward that we move today. In principle, we can work out the details, but we need to give a solid action to our frontline healthcare workers that we're in this together. And we've been told tonight that we have the jurisdiction to do it with ministerial approval. What the logistics of how the person will show their vaccination, we can roll that out at another time, but we need to start that process and give the indication to staff that that needs to happen tomorrow. We heard from Dr. Kaketla tonight that we're already past due on starting this. We need to get out of this pandemic. And the numbers for me tonight, I didn't know it was that bad. I didn't. You know, we see our weekly updates and regionally and Orange and whatnot. We didn't look too bad. But across the province with the highest rates per capita, the north looking as grim as it was here tonight. I don't think waiting on this one is justified. So I will put it forward that we move to have a proof of vaccination in the Malahide Uniplex.
I'll second that motion.
Any further questions, comments, concerns with the motion on the table?
If the motion goes to a vote, I would like it recorded.
Okay, I'll call the question. All in favor, say aye.
Aye. It was requested as a record.
Oh, right, sorry. Right, so we'll go, Councillor Sharp,
Aye.
Councillor Berry,
Aye.
Councillor Radowski,
Aye.
Aye.
and aye. Okay, motion is carried. So we'll move on. We'll move on to, where am I going here? Oh, the by-election report. So, the by-election, I guess Steve, I'll let you talk further about this.
We have 6 months from the vacancy to call an election to fill Councillor Watt's seat. I propose it tonight to set the election date of November 30th, just to give a little bit of time to get things in order and work priorities and whatnot, which is a Tuesday and it's not a council meeting in November. So pretty straightforward. We'll start the process. We'll largely involve a lot of staff doing the polling, clerks, stuff like that. We might have to enlist a couple of other individuals outside the organization, that's defined in the election bylaw in terms of what we pay for names and stuff like that. So this was not budgeted, of course, very, very unforeseen circumstance that we have to do, but tonight is the process of starting off the election by picking the date, and I'm suggesting November 30th.
Does anybody have any opposition to that? I'm in favor to whatever is best for administration, considering they're going to be doing.
I'm in favor as well, so do we need a motion for that?
Yeah.
Please.
I would like to move that we hold a by-election for the existing vacant position on November 30th, 2021.
Have a seconder?
I'll second.
Okay, any questions, comments, concerns? Okay, I'll call the question. All in favor say aye.
Aye.
All opposed say nay. Motion's carried. All right, the last,
Just one quick
Yeah.
resolution I need, Mayor, sorry, is
Yeah.
2.3. Statute municipal board, I just
Oh,
need
sorry.
that's a very, very quick one, that's a very, very silly formality. They've come back to us now, so they need an actual resolution to council authorizing it. So I just need a person to make a motion that we authorize administration to make application to basically SMB to investment, even though I've given it. So it's very, very formal.
I'll make a motion that administration be authorized to seek Saskatchewan Municipal Board approval for investing the town's fiscal reserves with RBC Dominion Securities.
second, okay. All in favor say aye.
Aye.
All opposed say nay. Motion's carried. Okay, the last item on the agenda tonight is the chip seal surfacing of the trout hanger as the contractors are currently in town. Does anybody have any questions about what is presented? Peter, do you want to add anything?
So just very quickly, contractors coming up, we've identified some additional work that needs to be done. We've got variances in the budget from some of our capital to allocate over, and this is just strictly, it's opportune time to get a handle on the maintenance that's on site, not leaving it for another year for it to fall apart. So it's timely, and this is why it's on tonight, because the contractor's up on the money doing the work.
Okay, I'll make that motion. I'll move that the 2021 chip seal budget for the airport be increased by $20,000 to accommodate the identified chip sealing in 2021 based on the information received within the report stating that we are coming in under budget in areas such as wages and vacancies that are currently occurring in the town of Orange.
Have a seconder?
I'll second.
Okay, all in favor say aye. Aye. All opposed say nay. Okay, motion's carried. Is there any other roundtable discussion at this meeting?
Need a motion in your
Perfect. And
Also,
okay, motion to adjourn. Thank you, everybody.
Thank you.
thank you.
Thanks, Jordan. I appreciate it.